All right. Good morning or good afternoon, wherever you may be joining us from. I think we have a few more in the waiting area, so we'll just wait till final admissions are done to start today's workshop. Okay, great. And that looks like it just was completed. Thank you again for joining us and learning about finding information you can trust online. For today's formal presentation, it's a Train the Trainer series for Dr. Google, finding information you can trust. Thanks to our past funding support from the National Networks of Libraries of Medicine, we were able to continue with this program and share the resources, which has been very relevant given our past year and a half now of really converting to a virtual world and so many people relying on the internet for getting information, particularly related to the COVID virus and just, the vaccines now. There's a lot of information done online and telemedicine. So I hope you find today's training very helpful and informative in your communications with just helping patients, community members, whoever it may be. This training is I like to think of it more informal. If you do have any questions, feel free to just unmute yourself, ask questions in the chat box, however it may be best to communicate your questions. Or if you have comments, please share. We'll do some breakout sessions throughout the workshop today so that you can just practice using these online resources and talking about some best practices for minimizing risk and sharing health information online. So just a heads up that we are going to do a couple breakout sessions. And with that, I am going to start. My name is Caitlyn Mowatt, and I'm the project manager at Wisconsin Health Literacy. I do a lot of community-based workshops. Prior to COVID, I was out in the community presenting these workshops in face-to-face learning environments, and now we've really shifted obviously to more virtual world and doing a lot of Zoom presentations. And given this topic today about health online and digital literacy was a little bit of a challenge because we're working with those that maybe have never worked on technology before or really just new to navigating online resources. So we have pivoted and adapted this workshop to include those virtual learners and just really making it diverse in-person learning or virtual learning. We do have 40 participants in today's workshop. So if you want to in the chat box, just share, your profession or where you're from. I would love to just get a little background on the participants, the audience here today, so I can maybe make some of the information relevant to you or share some suggestions. So if everyone can just take a moment and comment maybe profession or where you're from, your organization, that would be wonderful. Right, health educator, public health, great. American Heart Association, background in public health and health education. Seems like a lot of public health educators, health educators. This is great. Patient engagement specialist, so important. A nurse and a professor at the university. This is wonderful. We have a good wide range. Child and adolescent health, oncology. Strategic advisor, awesome. FedEx, that is good. Such a diverse group we have here today. I'm just reading through these. A health coach, professor at the university. Thank you for taking the time to share that. And it's great to connect. And if anyone wants to look in the chat box and see if any of those you may know. So for today's agenda, we are going to just do a very brief overview of health literacy. There's many workshops throughout today's and the past conference sessions on health literacy, what it is. We'll talk about digital health literacy, particular to health literacy, and sharing different communication techniques that can really just enhance your overall work in digital literacy. And then we're going to share a community-based workshop, which you'll see the image here is of the materials, the handouts that were presented, and you may have access to those through your event registration. We'll be referencing those in today's workshop. So we'll talk about that community-based workshop, how it's presented, and some of our findings that we heard and found from the surveys we collected and community member feedback, as well as how to implement health online in your community. And then we'll lastly just wrap up with some digital literacy resources and where you can find these materials and incorporate in your everyday conversations or your curriculum, lesson plans, whatever it may be. A little background on Wisconsin Health Literacy. So we are a statewide nonprofit organization offering education and training on health literacy. We're part of a really umbrella organization, Wisconsin Literacy, which you may have heard of, who serves over 70 member agencies, helping those on adult literacy and furthering maybe completing their GED, just basic reading and writing, tutoring with those students, and then also workforce development. We have some connections with and corrections. But really just strengthening those over literacy and being an advocate for adult literacy throughout the state and nation. As again, I mentioned, my role is primarily in the community projects, doing a lot of grant-funded programming on different health topics, from talking about the flu to talking about general medication, opioid safety and disposal, and then today's project on finding health online information and checking for credibility and just some good resources to do online searches. We also host our Health Literacy Summit every other year. So our next one will be in 2022. We took a little break. We are hoping to do our in-person workshop the first week in April of 2022. So look for communications on that coming out. You can always join our Health Literacy Digest that is on our website, wisconsinhealthliteracy.org, where you can get more information on that. And then here's just for visual learning of what our work is out in the field. We have here the left two pictures are our medication workshops that we've done at literacy agencies, senior centers, and really just taking the materials for these in-person workshops and talking about safe medication use. The middle image is the project we're talking about today, finding health information online. So we had the opportunity to take electronic devices, tablets, and Chromebooks and go to these different communities and work with community members on finding information online. And it was really that hands-on learning that made it so effective. So again, we're really pivoting now to utilize Zoom and these virtual platforms of sharing this information. The top right image is our Health Literacy Summit that we host in Madison, Wisconsin. And then we also have a national presence. We do a lot of advocacy and just presentations, conferences like today, talking about health literacy and the different projects that we are involved in. So Wisconsin Health Literacy, we like to think of health literacy as having two sides. It's really first a person's ability to access, understand, and use that health information to make those appropriate health decisions. So do they have the accessibility? And especially when we talk about online resources, we'll talk about that in a little bit, and really the limitations we found this past year of getting internet access or getting just the technology device. If they, that's step one, do they have the technology to then use the Wi-Fi access? And then it's really then also the other person's ability to clearly communicate how to access this information. And then clearly communicating for understanding and to use health information for better health. So two people together and using these strengths make health literacy better. When we talk about our provider consent forms and information, brochures that might be handed out, the information being talked about and shared, either printed materials or the health portals now where information's emailed and test results are shared on health portals. How is that being communicated? Talking about those emergency visits, those acute visits that people aren't prepared for, and their health literacy that has gone, out the door, and they're more focused on what's happening. I have something bleeding right now. Are they really comprehending all the information that they need to know? To then accessibility, talking about transportation. Do they have transportation to get to hospitals, to clinics for preventative care? Do they have access to get to health information online at the library and getting to use their internet access? There's a lot that can be done. And then also just wayfinding. Do they know how to navigate these systems, whether it be in person or in a virtual setting? And then there's medication use and medication errors that happen because of the implications of having low health literacy, right? So, are they taking medications correctly? Are they reading prescriptions correctly? Um, how are they administering it and the dosages? Do they know what the medication is for? So, there's a lot that can happen if one does not understand the medication they're taking and how to take it. And then the numerical impacts and risks that come with. Do they know how to do calculations? Do they understand the charts and information presented to them and doing calculations? Or do they need help with this information? And can you be an advocate and a support for helping them with calculations to really minimize that risk of misunderstanding the information or mispaying specific amounts, and just helping them with the bills or test results that might be given to them. So again, very brief overview, but from statistics done or studies being done, about 1 in 5 read at or below the 5th grade reading level. That's a pretty big number, right? When we think about the materials that are written, most healthcare information is written at or above the 10th grade reading level. And I know from personal experience, I worked at a hospital where I was in charge of doing a lot of the marketing materials, the brochures, online newsletters, online content. And it wasn't until I went to a health literacy conference at IHA, was actually the first one. This is how I came introduced to health literacy, was understanding what my readability levels were of the content I was presenting to patients and community members about our healthcare providers, the quarterly newsletters on different health topics we wanted to share, and the brochures that we were administering and having in the racks at clinics, that the information that I was taking from doctors or anesthesiologists or pharmacists and all that information, I was still writing at a 10th grade level. So here I thought I was doing a good job of making it easy for those to understand, but I still had a long ways to go. And really those that not only that 1 in 5 read at or below a 5th grade level, the comprehension is usually at a level below. So they might read at the 5th grade level, but what they're comprehending is really at the 4th grade level. So if you want to take a analogy and thinking about, well, what does this look like? Think about newspapers. A newspaper is mostly written at a 5th to 6th grade reading level. So if that helps you put into perspective of the language you should be using, that's a great resource to think about. So that was a very brief overview of health literacy, and I would like us to now shift our focus about talking about finding and understanding the information online, right? Because that's what we're really going to be training on today's workshop, is the information we're presented online, and how to check for credibility and talk about readability and navigating these websites. So think to yourself, or you can put in the chat box, again, a very informal discussion if you want to share out loud, of what do you do when you want to find ways to get healthy. Maybe your child has a rash, it's a new rash, it's taking over their body, concerned, what do you do? And then, or maybe you want to find the best health insurance. You need to do some online shopping for health insurance, whether it be through the marketplace or whatnot. Think for a moment, just what is your first inkling to do? Is it to go ask a family friend? Is it to go online? Is it to ask a doctor? What may be some of the first things that you do to find this information? Online, great. So I'm seeing some responses in the chat box. And overwhelmingly, I'm seeing a lot about Google, so thank you. Google is the #1 search engine used. And according to Pew Research, over 1 billion people search Google for health information every day. So that's just not regular searches. This is specific to health information. You can think about all the information that's being asked from I'm new to town. Where do I go find a doctor? Do they accept my health insurance? What are some healthy recipes that I can incorporate into my diabetic nutrition? So my diabetic diagnosis. What are some recipes that I can have? I need to get active. What are some good exercises I can do? Or what are some good websites I can learn more about my diagnosis? And there's a lot of other questions that are being done out there, particularly this past year. My symptoms, are they COVID related? Where do I get a vaccine? So a lot is being done on search engines, and just Google alone, you can see there's a lot. So searching online has become the new norm. You know, um, there's really not much of that back porch conversation, asking neighbor for a cup of sugar or health information. It's readily available at our fingertips if we have smartphones or tablets, computers. There's a lot of computers in homes now. And then many community businesses, offer Wi-Fi, or the libraries offer free, computer use for them to access this information. And according to 2013, so a few years ago, looking at the statistics, 81% of the adults use the internet, and 59% of US adults look up health information online. Now, fast forward to 2021, where we are now, you can only imagine, especially being in isolation this past year, of how much that percentage has increased. And about the information, health information online, I can only imagine that has increased as well. And there's a comment also about staying away from pictures. They're too scary. Yeah, so when we look up information online, it can be alarming when you see just pictures and it's that's not what I want to see. So maybe looking more content based. So thank you for sharing that comment, Armin. Um, According to Pew Research Center, roughly half of the adults, 53%, say the internet has been essential for them personally during the pandemic. So I think many of us can relate, as I'm home, working from home right now. I needed the internet to thrive through my work and get work done, but also telehealth, right? Getting doctor visits. Many of the clinics closed, and they're relying on virtual communication with their patients, of whether it be through the health portal and emails, sending test results, follow up through their charting, and then having maybe those non-urgent visits online with their patients. So the amount of health information, as I've been repeating over the past couple slides, is only increasing. Less and less printed materials. This is only becoming efficient for everybody. And also just keeping the information up to date. We're not having to find all those printed materials and get rid of them and replace with new printed materials. It's cost efficient of having the information online. And this is really important when we think about 50% of health searches have an impact on a person's health. Okay. This is important as we talk about patient-centered care, and the way that in the US particularly, patients are being asked to be involved in their healthcare decisions and making that process. So it's not, I'm going to the doctors, they're going to tell me what my diagnosis is, what to do, and I'm doing exactly what they say. In some countries, as I've learned on presenting this workshop in the past, that is not the norm. In some countries, they only listen, they expect the doctor to tell them what is happening and what to do. Where in the United States, we are taking this patient-centered care approach where we're involving patients more and more and asking, okay, here are a couple options. What's going to work best for you? And tell me, you've maybe done some research. Doctors are becoming more in tuned, and just it's becoming a natural part of the clinic visit of saying, what research have you done? What have you found online? I think if you would have asked doctors maybe 5 to 10 years ago, it wasn't really part of the norm of bringing information online. And some doctors had even said, I kind of got not so much annoyed, but just it was interrupting the patient care flow when they're like, well, this is what I found online. Am I supposed to do this? Where now it's just more of an expectation that the patients have already done that. And then unfortunately, though, we're seeing this digital divide, particularly among seniors and those with low health literacy. When you think about, we know about only 12%, again, this was back in 2003, a study done by the National Adult Assessment of Literacy had conducted a survey saying that only 12% were proficient in health literacy, and that about 36% were at or below the basic health literacy levels. So when we think about those numbers, only 15% of adults experiencing below basic health literacy find health information online. So there's not a lot, significantly less than half of those that are below basic health literacy go online to look up health information. While on the opposite side, based on, that 12% that reported being proficient in health literacy, 62% of those adults with proficient health literacy use online resources. So there's this big gap. If you're more proficient in health literacy, you're feeling, I'm going to go online to look up online health information, where those that are on the below or even at basic or below health literacy are less likely. But why? Why is there this digital divide? Well, there's difficulty finding reliable health information online. A lot of questioning. Is this a good resource? I don't even know how to navigate online. Maybe this is the first time I've been on a computer. How do I use these resources? And then navigating and reading. I'll share at the end here some of the focus groups that we had done with our literacy members and the students that they tutor, saying reading and navigating a website is a big challenge for them. It takes too much time. It's intimidating. How do we navigate the toolbars? And I just want to look up information quickly and know I'm on a website that I can find reliable health information. So there's that barrier there of not knowing how to do it, is why that you see only that 15% using these online resources. And then even a bigger issue definitely faced this past year was the accessibility to internet. So not only having internet in the homes, but now you take away places being open and offering these in-person services, or they now have to limit the number of those who can access their free devices and their internet. You run into accessibility concerns of who can go online to use the internet. Luckily, and I know in Wisconsin here, many of the libraries did drive-through hotspot clinics where the libraries would offer hotspots. Many of the community businesses would offer free Wi-Fi where community members could sit in the parking lots and use their Wi-Fi if they weren't open. So some of that, you see communities coming together and offering internet access, but there still are barriers in transportation, and are they able to get to those places to get that access? So we are going to look at a couple different screens here, and this is called usability testing. So if this is new to you, usability testing is done as an eye tracking exercise on websites to see how computer users are navigating the website to read information. So I have an image here on the left that you'll see, and then I have an image here on the right. And again, feel free to use the chat box or talk amongst yourselves of sharing which one do you think is experiencing a lower literacy level. Can you share with me which one do you think has difficulty navigating? Great. Yes. So in the comments, the one on the right is the one without the picture. Yes. So the one here on the right-hand side of the screen, thank you for participating and sharing your comments. This is the one, the user that has lower literacy and a harder time navigating this website. So that's why you see multiple dots, right? Here on the left, okay, we start from the top, we work down, we read, and it has kind of this natural left to right flow. Maybe they use the toolbar, they went to the image, but they still know to look at the information. Where here it is busy. It is very busy. Rereading of words is most likely being done. Um, Going back, how do I access the toolbar? What am I supposed to be going back and forth, back and forth? More time spent on this page. So again, you can see why, just from this eye tracking exercise, why one might not, with a lower literacy, lower health literacy levels, not want to access online information. So what can you do? Well, there's this adapting universal precautions, which some of you may have heard. If not, this is really just not assuming the unknown. So you can't always tell by looking. Um, and this is beyond just patient care. I have a visual here of thinking of doctors or nurses or those providers wearing gloves to minimize the risk of getting bloodborne pathogens, spreading of disease. So they wear the gloves, they take off the gloves, and they use hand hygiene. We've even so more especially this past year done, the masks to minimize risk and the spread of COVID. So those are precautions being taken because you can't tell by looking, right? You can't just tell by looking if this person has an illness that might be spread. So you take actions to minimize the risk for everyone. And this can be done in so many different work settings and so many different careers. And thinking about working with those that want to find health information online, you can't always tell by looking if this person has used online resources before. Do they have access to the internet at home? You're saying you're giving them all this information, but once they leave, where are they going to go to get that information and do the searches themselves? Um, you can't always tell by looking what their readability levels are. Are they able to read this information? At what level of the website are they more scholarly looking at research, or are we at the basic information? I just want everyday people, patient information on about a certain illness. So you can't tell by looking, and that's the best thing that you can do in your defense is just open it up for listening and hearing and asking questions of what level are you at? Where can I help you? Where can I meet you to find health information online? And then also using plain language with everyone. Um, Plain language is, not just health literacy. Health literacy is not just plain language, right? It's a lot more beyond that. But if you can use simple terms and find websites that have that plain language, that's going to be so much helpful for your users and those people that you work with to learn about the health information they're looking for. And then here I wanted to give this its own slide is to connect with libraries. Libraries are sometimes an underutilized resource, but yet when it comes to finding health information, it was reported, I was listening to a provider did a webcast here from the University of Wisconsin that said librarians are the second most trusted one trying to find health information, reliable health information. First being from a provider, whether it be a doctor or nurse or their healthcare provider, whoever it may be, librarians come second. They're a wealth of information from all the resources they have at the library and the training that they've done. So valuable information and really essential to communities is to be found of getting, free resources, providing computers for community members to use, providing free internet access, providing free books to check out and other hotspots to check out. But also they provide more. They're a space to host programming. So if you're looking for a space that you want to host for programming, community members love going to libraries and for their community events. So if you can do that, it's a great, usually central location for some to meet up at the library, and you're going to have reliable internet access, and you're going to be able to provide an online training about where to get health information. And then there's some other digital literacy strategies you can apply is slowing down. So again, find the pace that the person that you're working with trying to help talk about finding reliable health information online. What level are they at? Again, start from the basics and look at this last bullet point here. host technology trainings? Is that something that you need to do before you introduce how to find health information online? Do you need to talk about maybe how to use a computer and encourage them to either do a technology one-on-one training or have yourself host a technology one-on-one training? Um, then use Teachback. So Teachback, if you're not familiar with that, it's really asking, including questions and encouraging questions to verify and confirm the person that you were talking to, their understanding of what the message you're trying to relay. So, for example, just very not health related, if I'm trying to teach someone how to make a s'more, and I'm going through the steps of making a s'more, and then if I say, do you have any questions? Well, it really only leaves them for like a yes, no answer. And maybe they just want to make s'mores, so they're going to say no, but really they forgot what the first step was. So they missed that step. If you use teach back strategies such as saying, okay, I'm going over the ingredients. Before I get to the next steps, can you tell me what ingredients you would use in your s'more? You know, it's not to quiz them, say, list in order all the ingredients you need to make a s'more, blah, blah, blah. Make it more of a conversational piece and just a very inviting, shame-free conversation about, tell me what you would use, you know, and then just kind of make sure you get those main points checked off of that they have the essentials for making a s'more. And then you can just encourage, you know, that conversation and asking those questions. So in a technology setting, and we're talking about health information online, you know, we've gone over a lot of websites today. What are the top 3 that you would like to go to after our session today? You know, what are the top 3 websites you're going to reference after today? So just make sure that they hit on those, at least 3 of the ones that you listed and that information. And then help with accessibility. Again, if you can encourage, if your community offers free Wi-Fi, free hotspots, maybe there's devices that they can check out, that would be very helpful for the participants to find the information online. And then when doing any training, I do a lot of workshops. You know, I consider myself a health educator, but I'm not a doctor. I'm not a pharmacist. So I always use this disclaimer as saying, you know, I'm not a doctor or pharmacist. I'm not here to diagnose or recommend treatment in a certain way. And this is important when we talk about websites too. You know, I'm not here to say that these websites are being used to diagnose you or treat any symptoms that you might be having, and that any information found on any website does not replace the advice of a medical professional. So you want to make sure you use your disclaimers in there if for your own professional background, and you can personalize it the way you need to. But that is very important, just so they know, especially when we talk about online resources, they're not there to just say, this is what you have, this is what you need to do, this is your diagnosis, because the websites don't know your history. They don't know, you know, what other possibilities might be going on. Maybe you missed a symptom. So these are things that, again, the online resources are good ways to research and get background information to then talk with a medical professional about, to maybe confirm what you researched or to put you in another direction and give you different advice. So at this time, we are going to break out into some breakout rooms. There'll be about 4 people to each room. We do 10 breakout rooms, and take about 4 to 5 minutes to share what are some ways that you're already or can adapt universal precautions in your setting and finding health information online. If you can think about what ways are you doing in your community, and if you haven't applied this tool, you can talk about adapting universal precautions in any realm of the work that you do, because we can always learn. Maybe it's a new strategy we can use in digital literacy. So just have that conversation. Think about ways that you can minimize risk for miscommunication, ways that maybe you've helped with this accessibility, and just kind of over the list that we've talked about. So I think George is going to break us out into some breakout rooms at this time, and I will be in the main room. If you have any questions or concerns, please let me know. I'll be in the main breakout room, and everyone can be assigned now. Thank you. All right, I think we should be having everyone coming back from the breakout rooms at this time. Great, it looks like everyone's joining us again. Great, thank you. So I think we have everyone back. George, just to confirm. And from those that are coming in, do you want to start sharing maybe some best practices your team talked about? We can put in the chat box.
Family members.
Oh, I think someone just got cut off. What was that? All right. I'm not sure if the microphone was working there. Someone started speaking. But hopefully everyone had great conversations and were able to share some best practices that were happening around adapting universal precautions, whether it be, you know, face-to-face communications and just not assuming, again, like we talked about, that everyone has understanding and abilities to work online and work on a computer, to what websites are the best. And then also just of navigating the areas that you offer. Okay, we see some in the chat box coming in. We use a lot of pictures, large font, and maximum of 3rd grade reading level. That's great. Thank you, Meg. And Alexis shares we offer health education online for our Cribs for Kids program by allowing participants to watch a safe sleep video, but then we call them to follow up while completing their application to do one-on-one consultations to confirm understanding. Fantastic. So a little bit of method of teach back using in there to make sure they're getting the understanding how to complete the applications and having a visual with the video. That is wonderful. Thank you for sharing that. So now we're going to dive into our Health Online program. Again, this was in collaboration with the National Network of Libraries of Medicine, particularly the greater Midwest region. They are going through a new transition. So if you are familiar with, it's NNLM, they are now, greater Midwest region is no longer, and it's now region 6. So just an update in case you're looking to do some research on them. But we started this program about 3 years ago, and the goal was to help consumers, especially from vulnerable populations and those at risk for low health literacy, identify and effectively use trustworthy sources of online health information. Now, there are a couple handouts, and again, this was provided in the registration materials. So if you don't have access to these, I will make sure to share a link at the end where you can get these handouts. We do have them on our website, as well as NNLM has them on their website. But here is just the first page is the handout listing the websites that we recommend, and the back page is a checklist that we use, and we'll have a chance to review this today in our training of talking about ways to check for credibility. And then we do provide another handout. This is the second one, where it's the curriculum that you see online, just in a print form. This was really important to some of our pilot workshops that we did to have piece of information that they can take home on paper, again, with accessibility concerns in case they didn't have the internet home and they wanted to share it with someone else. And then also to take room for space to take their notes. Because they might just have a different way of saying stuff, so they wanted to have that space to make sure they write it down. So when we look at the online curriculum next, you'll see that there is this information already outlined on the website. And then the website that we do reference for our online curriculum, anyone can reference it at any time, is at the bottom of the handout on the second handout here. So the community-based workshop, there's 2 phases of this done. And over those 2 phases, we were able to do 90-minute workshops in communities. And we found throughout the workshops, it really depended on the level of learning. We broke it into 3 different levels, really, with a beginner, intermediate, and advanced level, just really based on one, the technology use, is technology new to them? And then we also considered just literacy levels for non-native English speakers, because since the workshops were primarily presented in English, there wasn't always an interpreter there. If we could, we would get interpreters there. Highly recommended when going through this information. And there also is information, a lot of websites that can be translated. So we had some different variances in giving our audience in the amount of time that we needed. So definitely gauge that if you're going to be doing this training, this workshop, to gauge your audience, what their level is at for using technology, and what their literacy level is at for just understanding the information, and particularly in English, or if you need to work with translators, interpreters to get the information in their language. We do have the surveys that we use. We did pre and post surveys just to gauge program knowledge-based learning, and then also if any improvements need to be done for the grant. So we do have those in English, Spanish, Swahili, we have a Chinese, we have Hmong, we have I think there's about 9 different languages that we have this translated in. So if anyone ends up using this content, this curriculum, please reach out to me. We also have the handouts as well. So the handouts I just showed you are translated in those languages. And then there is a facilitator script. So our facilitated script is based on health literacy principles. We've really used plain language to develop the facilitator script. That is a step-by-step guide to go through the online program, the curriculum that I'm about to show you, to guide you through and say, okay, this is what we're going to say next, and this is why you want to say it. And here's some additional tips to share with the participants in the workshop. And this doesn't always need to be done in a workshop setting, whether you'll be working one-on-one with somebody, or just apply some of these concepts in your everyday work and the information you're sharing, whether it be with patients or clients, and just take some of these tidbits that we are about to cover here in a little bit of how you can apply it to your work. So the online program that I'm going to share with you, again, it's based on the URL that was on the handout, and I'm hoping that everyone can see now. I am sharing the URL, the online curriculum. So if you're unable to see it, please let me know in the chat. And then someone had questioned, are these fillable forms? Many do not have printers anymore. When you talk about forms, are you talking about the handouts, or are you asking about the surveys, or all of it? I just want to make sure I'm addressing that question correctly. Yes, your handouts. So the handouts are not fillable in PDF. We created and just saved them, but that is a great idea, and something that I can recommend with NNLM, who is continuing this program, and we're going to be updating materials here in the near future. So I will make that recommendation that we create the handouts in a fillable form for just the convenience of everyone. Like you said, more and more information is online, so that is wonderful. Thank you for sharing that. Okay, so here you'll see the curriculum, and we talk about, again, what we're going to be covering in today's workshop. So we're searching for health information that can be trusted, how to read a web page, finding quick facts and those key points on reading the web page, how to tell if the information you found is from a good source, finding websites in other languages, the differences between using a computer or a mobile device, local places to use the internet, and then using other online resources for your health. So as you can see, there is a lot of content to be reviewed in that 90 minutes. So I highly encourage you, if you can, maybe split it up into two 1 hour sections. That is, I was able to do that with some workshops just based on timing. If you are doing this in a virtual setting, it is really hard to keep audience on for 90 minutes in doing this workshop. So again, I really encourage you to do the two 1 hour sessions for virtual learning. That has seemed to work well. And then you can always, also another idea is just to split this up into, 30-minute sessions and just do the different topics and pick and choose what you need to do. So it doesn't need to be followed section for section. Maybe there's points that are not applicable to your audience, and then you can just skip over those. But it's use as you want and personalize as you wish. We do talk about common web terms as a brief overview and introduction to the course. Is just this is, again, using those universal precautions and not assuming everyone knows the languages that we use in the workshop. So talk about a URL. Our URL is, and make sure to point the web address that we use, the www dot, the search bar. Where do we find search bars on search engines? And this goes down to the level, do you need to talk about what a search engine is? So are you opening up Google? And this is a search engine. Here's a search bar. Show them. When we want to, we can use this right here as a search bar. So there's a lot of information that can be shared about what the terms mean. The browser, what is a browser? Some people don't know how to open up the internet. So when you say turn to your, go to your browser, well, what is that? Well, when I'm looking for my browser, usually at the bottom of my screen here, just within the presentation mode I'm in, it doesn't show, but you can see the icons, and you have either Internet Explorer, maybe Firefox, Google Chrome, and then if you're using Apple devices, it's Safari. So differentiate what those browsers are. A domain is at the end of your URL. So again, I'm referencing domain to URL when I talk about it. So this is why it's important to make sure we go over these terms first. Social media. Social media is not covered in depth in this workshop. And we get a lot of questions about this. Like, well, I go to social media a lot. I go on, YouTube and watch videos, or I go on Facebook pages. This can go down a black hole fast of information, and that's why it's not covered in this curriculum. It definitely could be its own curriculum, and I think there's probably some great resources out there just on social media content and misinformation. That's the new buzzword out there, is how to navigate around misinformation online as more and more people go to social media. So I hope that's a project that we can work on in the near future, but it's just not something that we really go in depth in this curriculum. If anyone asks about Facebook and Twitter and YouTube, it's encouraged, if they want to follow and look up resources on these sites, is to follow maybe a clinic, so a certain health clinic in your community. They usually share information from doctors, some articles shared that's been reviewed by medical professionals. Maybe your local library you want to follow. Sometimes they share up-to-date information, especially as it's related to COVID. County health departments as well. So this is some of the content. If they want to follow these pages on who to follow, would be some recommendations of those trusted community partners. Scrolling, again, how do we scroll through the pages? If you're giving someone a tablet or a phone, of showing how to scroll using your hands and how to zoom in and out. That is some of the important tools. Again, some things we take for granted on knowing how to use a mouse, of what we use. And remember, a mouse can be a jargon word used because some people may literally take it as the rodent mouse. So to scroll, I have my cursor, right? And then we have spam. So what is spam? We talk about checking for credibility and being cautious of spam on pages. And what does that word mean? And then hyperlink. Hyperlink is something that comes on a lot of pop-ups. Maybe it's embedded in emails, but you want to check your hyperlinks for credibility. And how do we do that? So this is something that is covered in the program. I'll just show you now, since we're on this topic, to check a hyperlink for credibility. You see when I hover over my cursor, it goes from an arrow to a hand. And keep an eye on the bottom left screen here as well. When I go over it, you'll see wisconsinliteracy.org /health literacy /index.html. That's confirming I know what I'm clicking on. So that's checking my hyperlink for credibility that I am okay with going to that website. Because especially when you get those pop-ups that come up, advertisements, do you know, is it really related to the website you're on, or is it sending me to some spam website, or am I going to get a virus from clicking on here because I don't know what that hyperlink goes to? So that is an important tool to tell them on how to check for credibility. How can using online resources be helpful? Again, convenience of having it at your fingertips, of having mobile devices, but then also being able to use your online resources in your community, such as libraries. Some hospitals might have a community business room that you can use. County health departments might have some. So just get to know your community and what accessibility is out there. You can check for health symptoms, research diseases, communicate with your doctor. This has become a big one on the health portals that are being used. And we don't get in depth on how to use a health portal. There are some videos out there that you can definitely show them, but every health portal is different. It's based on the health system and how it looks and what tools are available. For the most part, they can look up their test results, pay bills, they can send an email to a provider. And there's also an online library in many where you can look up health information on these portals, but they're all different. So it's very hard to show a video when the navigating may be different from person to person. And there's many other things that you can do for the benefits of using online resources. So then we search for health information. We talk about the search engines. So Google, Bing are two of the more popular, but again, ask your audience, what do you use for search? What do you use to look up information? This is called a search engine, okay? And this is where we go. So again, you can show them, click on the hyperlinks. If you are able to let your participants be on the website while you're teaching, have them click on it, get them comfortable with using these. The difference between a search engine and search bars on a website. So when I go on Google, I'm looking up on the whole World Wide Web, all the information. But if I were to be going, for example, I'll just look up on our organization's webpage, if I use the search tool, this information is only, that I search is only going to be from the website that I'm on and not the whole World Wide Web. So that is a limitation, just so people don't get confused. Like, I'm searching, I'm using this website I always go to, but I'm only getting this limited amount of information because you're not using a different search engine. But that can be a positive because sometimes it's limited in the amount of information and less results to go to. And then there's search tools for privacy. So DuckDuckGo, this is very similar to Google. Although when we do these searches, they are not tracking information. So this can be very important to those that might be putting in health information, and whether they be paying bills or having to put in street address information, other personal information, social security information. DuckDuckGo is more on the search engine side. So this is going to be with your searching and then going to that website. That's all going to be on a non-tracked, private searches, tracker blocking, and site encryption. But then if we want all of our tabs up here to be in a private mode, we can do browsers, which is this image here in the black. This is the Google Chrome Incognito browser. So anything I do on any website then, whether it be in Google, whether it be on a different website, is going to be protected. It's important though to let people know that, schools and businesses, employers, Some websites you visit, they're still able to see what websites you go to. They're not able to track your information and all that, but it's important to put that disclaimer because some people think that, well, if I use this Google Chrome incognito browser, no one's going to know that I looked up this website when maybe they shouldn't be, just based on policies and procedures for using online resources in a library setting or a work setting or school setting. That's just important to make sure they know that. But this is the privacy tools. Again, this is also available in Firefox, Internet Explorer, Safari for Apple users have a privacy browser. It really just allows that extra layer of privacy for entering all that information I talked about before with the bills and personal street address information and looking at maybe the health charts if you want to go onto your health portal. That would be nicely done in a privacy browser. And I'm just looking again on the comments, and it said, sounds like this could even be split into 3 separate workshops, with the third or first in a series would be basic internet skills. This allows users to skip the basics if they're already familiar. Yes, absolutely. So that's a great, Jacqueline had mentioned about maybe splitting this into 3 and allowing the Technology 101 course at the beginning and allowing those to opt in or out if based on their technology levels. That's a great suggestion. Thank you. And then tips for doing a search. So why do we recommend still using Google and Bing? Well, we're working with everybody out there. As you can see, based on that statistic, over 1 billion searches are done just on health information alone. So we don't want to say, don't search Google, use this and this website always. We don't want to work against people. It's a habit. It's just a natural thing. When you go and look up something, you're going to use one of these search engines. So if we can make things better for them, we want to provide tips for doing these searches to get the better search results. So you list multiple symptoms, right? The more descriptive you can be in your search, the more narrowed search results you're going to get. Use a full disease name, because all those acronyms, or even, this is kind of similar as well, limiting abbreviations. Google or whatever search engine you use doesn't always know that it's health related if you're going to start throwing out acronyms and abbreviations or using text hands with the LOLs and the OMGs. But obviously more health related. But just as an example, Google's not always going to know that's particularly what you're referencing. So if you can use a full disease name, it gets better results. And then again, even more specific in gender and age will provide better results. So then we have the participants do a search, trying to search based on the scenario, upper respiratory infection, cold, and URI. And this is based off of really using the full disease name and not using abbreviations, and then having them practice using 3 different search engines. So for the convenience of time, I'm going to show you here using Google of what I mean by having them upper respiratory infection. Okay, so we have them look this up. And when I use the full disease name, I get upper respiratory infection in my title. I see it in my brief description here. I even see the acronym URI. I get just over 173 billion or 100. I get 173 billion search results using this. So it is a lot. And it's not to say you need to go through all these search results and look through them and see which one's the best. But scroll through, the first page, maybe even going to the second page and seeing which one, based on the credibility tools we talk about next, is going to be a good candidate. So we have URI. Again, all of our search results talk about upper respiratory infection in the titles and in the descriptions. But what happens if we just say cold? Okay, I get even more, okay, over 1 trillion search results. So this is a more general term. I see upper respiratory tract infection in here in the description, I don't see it in the titles though, really. And again, not in a lot of the descriptions. Common cold, talking about cold and flu. So it's not the same search results as I would get, and it's more information trying to sift through if I just were to use the full disease name. And then what about if I look up URI? So for example, sometimes doctors use shorthand and they just say, it sounds like you tore your ACL, or you have IBS. And, what if they just say, it looks like you have URI? If I were just to Google that, I get the University of Rhode Island, I get the Uniform Resource Identifier. I'm not getting anything particular to upper respiratory infection. It looks like there's a movie out about this. So yeah, there's nothing medical about just the acronym URI. So if I put the word medical after it though, all right, now Google knows I'm talking about this medical condition, upper respiratory tract infection. Upper respiratory infection, okay? So you'll see that you get better search results. So those are some of the things you can do with your participants to say, let's just do this example and see what you get for search results based on the information you search in Google. And then identifying how to read a web page, scanning, talking about the information provided. So we have on the screen here, whoops, a chat box just. So on the screen here, you'll see an image, and this is just a general example of maybe a typical web page you might come across on reading an article. And the main content that is shown here should have the information you searched. If you click on a web page and you just see the words that you searched in the blue section, the supplementary content or the secondary content, it's the main focus of that website is not going to be on what you're searching for, so you're going to want to find a different web page, a different article. And then you'll also see in the red here are ads. And ads are not meaning that the website is bad. There actually can be a lot of websites that have ads because they need it. They need the funds to keep the website going. So you want to make sure you base the information on what is in the ads, okay? What are they seeing? Is it appropriate? Is it far-fetched? And what I mean by far-fetched, are they trying to sell you on maybe a weight loss product? That seems to be one of the more common ones. Take this miracle pill and you'll lose 20 pounds in 2 days. And okay, well, that's not good and healthy. So what is this website really checking based on their ads? Are they supporting this ad? And what does that mean, the information that they're sharing on their website? So ads can say a lot about a website based on what you see. So again, review more of this. Reading a web page. Some more. This is such a good, okay, I'm just reading the chat feature. I want to make sure I'm staying up to date on that. So thank you for the comments. And then we also talk about scanning. So I mentioned before, scanning multiple results, not only the top 2 results. And this is because a lot of time in search engines, sometimes they're paid advertisements. Again, going back to the ads, Google runs on advertisements. So if someone is paying to have their advertisement on top, it doesn't always mean that's the best information that the person is trying to search and get the best information on that search result. So you need to scroll through the search results and see, okay, I'm checking. And then you want to check, okay, you're checking the domain. On here, you're checking the titles, you're checking dates if they add those. There's a lot of information to look for. And if you don't find what you want, start over with a new search result. If you continue to add words, you're just going to get further down the hole and not get good results. So here goes into the really, the heart of the program is checking for credibility. And it's important to take your time when talking about this because everyone has their own pace and trying to find these sections on a website can be difficult. So credibility is proof that information is reliable. But there are four main ways to check for credibility. You want to look at the About Us section. So we want to find out why they have the website, who supports the website, really get a good feel for the About Us section. Look for unbiased research so that it's not based on someone's opinion. It should be supported by facts, research. And then check the bottom of the web page for dates, sponsors, crediting, and other details. And I'll share with you, I'm going to share a website with you here where we look at all this in just a moment. And then also the domain differences. This can say a lot. Again, when going back to our Google search, just the domains that are provided on the search results. And I will give you a hint, if you're using a tablet or mobile device, they don't always show the URLs on the search results. So you might have to, again, hover over the link to see what the URL is, but those are not always displayed. The mobile device has a whole new look to it based on what you see using a computer or laptop. But domains, a .com, this is the one we want to be most cautious of because it's most likely owned by a commercial business, meaning that they're trying to sell you something. Not all .com websites are bad. Okay, I used wixsite.com to create this online curriculum, but that gives you an idea that anyone can create a .com website, and that's really important to know and to share with those you're teaching this to. Is .com can be created by anyone, so anyone can create a health website. .gov is government-owned website. .org most likely owned by a nonprofit, and .edu is owned by a school. Okay, so these are the criteria that need to use these domains. And then there's an exercise. This is where you would use that checklist that was provided on the handout to compare websites for credibility and think about things to look for, such as medical providers writing articles about topics in their practice. So you have maybe a foot doctor writing an article. Well, I hope that foot doctor is sharing information about foot surgery, or maybe, about bunions or whatever, maybe, and not about brain surgery. Those are two different specialties. So make sure that is looked out for. Contact information. Is the information clear, straightforward? Are they not hiding? It's so like information they could be hiding is, how do you contact them? Okay. Is it at the bottom of the page, or is it hidden and you have to click on 5 different links to get to that contact information? What about any crediting and who's reviewing the information? Are they trying to hide that? Which brings us to content reviewed by medical professionals. So medical professionals should be reviewing this information, not medical experts. Okay, this is something to be cautious of. Medical experts, anyone can claim they're an expert in anything. After this training today, you could say you're an expert in digital literacy, right? And maybe this is the first course that you've had. So are you really an expert, or are you just new to learning it? Quick way to check for medical professionals is if they have their titles or their credentials next to their name. And then evidence-based, based on credible findings. Are they saying, this is supported by this survey or this study, this statistics show based on these findings? And then look at the privacy policies. If the privacy policies say, we're going to share your information with a third-party vendor if you subscribe to our newsletter, well, this is where you can tell your clients and patients, this is probably going to be sending you spam email if they have a third-party vendor they're sharing your information with, because that means that they're soliciting it to other marketing companies, and it's not just solely proprietary to the company organization you're subscribing with. So that's another thing to just look into. And a lot of websites are starting to make their privacy policies easier to read. They're not just the teeny tiny print anymore. So take the time to review that. And then again, be cautious of certain brand names or products being credited, content review by medical experts, and then opinion-based. So if you see, I think, we feel, we believe, those are some red flag words of, this is not evidence-based, this is based on someone's opinion. And then lastly, I just want to show you, so I said I would mention a website and review one. There is a full list of websites here, and I encourage you that the facilitator script explains what each one of these websites are. We do have one for specific for those living in Wisconsin, and you could personalize this for based on the state that you go to, but it's based on our Medicaid program here. Our Medicaid is the second link. The first one is our online library through the state. And then this last one is patientpartnerships.org is a website for those that might have legal questions or concerns, maybe need to have a patient advocacy, help with healthcare system navigation, or I don't know how to pay my bill, how do I do this, or I had a bad experience at the hospital. There are some great networks. There's even some national networks out there. I would just reference the one for Wisconsin, given our curriculum was, our project was specific for Wisconsin residents. But again, there's a list of websites on here that's talked about in the facilitators guides. The one I want to show you is Medline Plus, and this is through the U.S. National Libraries of Medicine. They do a great job of just making it user-friendly. They have a toolbar, a top toolbar, a side toolbar, and they talk about so many different health topics, and then they provide videos and tools on different health topics. And one of my favorite things about this site is they provide medical information in multiple languages. And they have over 50 different languages that they translate different health topics on. It just comes in very handy. So you can see there. But checking for credibility on this website, you'd want to go to the About Us site. So About Medline Plus, and they share with you, this is where I learn about the website. And these are what I mentioned before on checking for credibility, their About Us section. Most of the time it's on the top or in a drop-down menu. But sometimes when they make them hard to find, maybe at their bottom of websites or they're hidden within multiple pages, be cautious of that. Checking the bottom of the web page, here they reference their supporters, the U.S. National Libraries of Medicine, and I can see that I can click on this hyperlink to go to other websites. Okay, I can confirm that this place actually exists and they have a website. I get a physical location, more supporters, and then I get, this is important, the page was last updated March 24th, and it's particular, it says like this page was updated on March 24th. So I know this website, Medline Plus, they say it in their About Us section, they update it daily on different pages to make sure everything's up to date. If it has not been updated within the past 5 years, those are things, okay, someone maintaining the website, the organization no longer exists, is the information out to date? Just be cautious of that. So then the website goes through a list of other curriculum, and I want to be cautious of time, that we have about 10 minutes left, and I want to make sure we have time for questions. So again, the facilitator script goes through on how to talk about all these other topics. And again, the website's in multiple languages. Many of the websites that we reference translate into Spanish, which is very user-friendly. They translate everything. It's just not extra handouts translated. Differences between mobile and computer devices. And then just be an advocate for your community resources and where they can find online support, free Wi-Fi access. And then I briefly mentioned already the health portal. If you need to update this at all with yours, you can always just have that as already up in your tabs and say, I know many of us, you have this health system, this health portal, and you can always walk through that if you feel comfortable. The one referenced here is through the University of Wisconsin-Madison, the UW Health System. So that is the example we give. And then briefly on wearables and apps. And then newsletters. So that is the online curriculum. Again, access it at any time. I'm now going to minimize that. So what we're learning is, and thank you, there's a comment that Medline Plus is the top choice. Awesome, especially because of translated materials. So great to hear that it's used elsewhere. We have learned, again, from the adult literacy survey that people want to find health information on symptoms, resources to stay healthy, and in other languages. So that's really what helped us create the curriculum we did of covering those needs. And then they want help scanning websites for relevancy. So we made sure to have that point on how to read a web page. Younger populations preferred MyChart or searching out symptoms. When we worked on with this focus group, where older populations preferred urgent care or primary care, so having that face-to-face interaction and not using online resources. Again, this is where we see the digital divide, where older populations are less likely to use online resources, and younger populations, prefer have the smartphones and tablets that they're accessing. And then the most used websites are Mayo Clinic, WebMD, and they search Google. And this, we just finished our second phase of the program. So if you go on our website, we'll have more updated information. We were able to, again, exceed our project objectives in making sure that those were positively identifying reliable websites, using evaluation techniques to find credible websites, and overall confidence level was increasing to find good health information after they completed the workshop. So to get involved, you can become familiar with the online program that we talked about here. Feel free, please reach out to me at any time and I can share curriculum resources, just have a conversation with you if you have more questions. Learn what websites are reliable in your practice. Many health educators I saw out there, but if there's other more specific websites that you can relate to, especially to your community, that would be a great resource for them. Please share that. Bookmark Medline Plus if you already haven't. It's just a very user-friendly tool. Host a workshop and then partner with community organizations to help spread the word. And I think we're almost out of time here. I'm going to skip this last breakout section on how you're keeping community members engaged, but feel free please to share that in the chat box if you can, what you've been doing, especially in the past year of keeping community members engaged in our virtual world, or maybe things that you're doing and programming that you've done in the past of keeping community members engaged. I think everyone's looking for some useful tips, especially in the digital world we're living. And then the last is the resources I said I would share with you. The NNLM has them listed on their website. So as you see here, they have a whole digital health literacy, and they have the curriculum, the slides, the program script, and the handouts I referenced, as well as I did a video training very similar to this about 1.5 years ago, if you want to look at that. And they are going to be doing some more updates to their online programming. So continuing to follow this website, they have great resources. And then here's our website where we have the program results. We did an interview with a doctor recently that shares COVID information and finding health information online, and a lot of great tips. And then Pew Research Center, just for general digital literacy. I reference them a lot in this workshop, so check them out. Thanking our funders. And then tell me what questions you have.
Hi, Caitlyn. Thank you so much for this. This was really, really great. I was curious, the research was done with English learners, is that correct?
Yes.
Is the kind of the next step and the next thought about what, English second language learners?
Yeah, so we did a mixture of both, I would say. We worked with adult literacy learners to do some research based on those focus groups. And we are working with NNLM to create videos based on the workshops that we've done. So there's going to be 7 videos published right now in English and Spanish. And these are going to be then piloted in work groups to see if other languages, if there's a request for other languages. We also have guides out there. And again, this is all going to be published. It's just like in the final processing stage through NNLM of, in their All of Us research program to share guides, user guides for you to also expand on this and use their resources in multiple languages in different community, with different community settings, different cultures, taking into consideration not just language differences, but cultural differences. And, you know, maybe we worked with the LGBTQ community to do that. We worked with refugee and immigrant communities. We worked with the African American communities. We worked with the Latinx communities. So we really wanted to take into consideration not just on language, but also cultural information. And that's the next phase of this program that will be shared again through NNLM. Any other questions? If you would like to, again, subscribe, our Health Literacy Digest will have the information that's going to be updated on the progress of the next phase for this program and reaching those different audiences. So I encourage you to subscribe to that, but if not, just take down my email and send me an email saying you'd like information on this as it comes about, and I'd be happy to send that your way. Thank you all for the comments. It was wonderful having you in today's workshop.